Well, good morning, everybody. My name is Dr. Silvio Papapietro. I'm a cardiologist at UAB, and I work at Cullman Regional. What I want to do today is talk to you about some issues that you can do as a patient or a person to avoid or minimize the risk of developing heart disease. If you do have heart disease, then my suggestion is I'll talk to you about trying to minimize the risk of your disease becoming more severe. And hopefully, if you follow some of this advice, you will live a more comfortable life and perhaps a longer life. Now, some of the things I will talk about today are general recommendations for anybody with any type of heart disease. My first advice, of course, is follow what your doctor tells you, do what it says, take your medications. That comes without saying. If you smoke, of course, quit smoking. Cigarette is the number 1 or 2 killer in this country. It increases the risk of heart disease. It increases the risk of multiple cancers. So it goes without saying that if you're a smoker, you should not just cut back, but quit. The first thing I want to talk to you about is physical activity. Now, this is a major issue, I think, for everybody, especially in Alabama and in the Southeast. I can tell you that according to some of the latest information, about 32% of Alabamians are overweight and about 36% of Alabamians are obese. That means that out of 100 people in Alabama, 60 to 70 are either overweight or obese. And that's a major issue because obesity carries with itself a multitude of health-related issues. Obesity increases the risk of diabetes, and diabetes, of course, increases the risk of high blood pressure, kidney disease, arteriosclerosis, heart attacks, and stroke. Obesity in itself increases the risk of high blood pressure. High blood pressure leads eventually to weakening of the heart muscle, heart failure, and death. Obesity tends to increase the risk of arteriosclerosis, and that's the process by which the arteries in the heart and in your brain narrow down so that the blood supply decreases, and that can lead to heart attacks and strokes. It also increases the risk of sleep apnea. That's why people who are obese snore at night. They can't really breathe very well. The oxygen in the blood drops, and that leads to high blood pressure, irregular heartbeats, and some other complications like heart failure. So obesity is a major problem. That leads us to one of the things that I want to discuss is diet and physical activity. Now, I want to talk to you before I talked about the diet. I want to talk about physical activity. We have become a world of inactive individuals. We're couch potatoes now. You know, in the old days, maybe 100 or 200 years ago, our ancestors were physically active. They had to walk to go to the grocery store. They had to walk to go to the field. Men had to go and hunt for a living sometimes. So we're talking about centuries ago. Women had to walk to the river to wash their clothes. There were no elevators, no cars, no airplanes, and obesity did not exist. Diabetes did not exist. Gradually, with the progress that we've accomplished over the past centuries, we have become a race of inactive individuals. We don't do much to move around. Perhaps one of the best examples that I can remember personally is driving a car. I remember when I was a kid, my dad had a car that had a clutch so that every time you drove, you had to push the left foot to change gears because it was a manual transmission with a lever either on the floor or attached to the steering axis. There were knobs to rotate if you wanted to turn the radio, and if you wanted to turn right or left, you had to stick your hand on the left to go left, or go up if you wanted to turn right. And then the thing that I hated the most as a kid was when my dad told me to roll up the windows, and I had to move and do this for the rear window on the right and the front window on the left. All that is gone. The new cars now have no clutch. You always use your right foot. There's no shifting, and then you don't even have to move your wrist to turn the radio. You just push buttons. We're being told that in a few years we'll have cars that will drive themselves. So not only will we be able to be drinking coffee, but we'll be able to be eating our own steak in the car with a fork and a knife because the car will drive itself. Now, this may sound like a joke, but it's not a joke. There's been a study shown some years ago where somebody calculated that just by driving a new car and not having to do any of the things that people did before, we gain about a pound of weight every year. That's just because we're saving those calories that we used to manipulate the car. We don't have to do it. So it's 1 pound per year means that in 5 years, if everything stays the same, we gain about 5 pounds simply by driving a new car. Now you multiply this for everything else. We drive to the store, we go through the window of the bank, we don't walk into the bank. For the laundry, we drop our dirty clothes, we don't get out of the car, and now with the pandemic, we have curbside service, so we don't even have to walk into the restaurant. And this applies everywhere. Our ancestors used to walk, and I'm not telling you to do exercise, I'm telling you to be physically active. We know that physical activity prolongs your life. We know that even the most trivial physical activity is beneficial. Even if you get up in the morning and walk to the mailbox and walk upstairs or downstairs, you have a lower risk of dying from heart disease and some cancers. So it's extremely important to be physically active. We no longer turn the TV, we just use the control. When I was a kid, I had to get up to turn the channels. There's study after study after study showing that physical activity, even in minimal amounts, is very important. It increases muscle strength, it makes you feel better, it increases endurance by strengthening your heart muscles. Physical activity lowers blood pressure, lowers your bad cholesterol, and reduces the risk of some cancer. There's clear information that women who are physically active have a lower risk of breast cancer. And again, I'm not telling you to go jogging or to go to the gym. I'm telling you to be physically active. I'm telling you to, when you go to Walmart, park the car as far away from the main entrance so that you force yourself to walk back and forth. I have given probably 2 or 3 special handicap parking permits in my life, and I've been doing medicine for over 30 years. When my patients ask me for a handicap permit because they have heart disease, I tell them, I care too much for you, so I'm not going to give you a handicap permit. I don't want you to park right next to the entrance of Walmart when you go to Walmart. I want you to park as far away as you can so that you walk back and forth, because that will help you lower weight. It will strengthen your muscles. It will lower your cholesterol. It will lower your blood pressure, and you will live longer. So physical activity is extremely important. I can tell you one more piece of information. There's a study showing that in nursing homes, those patients who stand for an hour or 2 hours a day live longer than those people who sit all day. Now, maybe the ones that stand are a little healthier than the ones that sit. That's why they stand. But the point being that even minimum degrees of physical activities are good for your health. You will live a more comfortable and longer life if you're physically active. So try to minimize some of the electronics and all the advancement we have available today and force yourself to be physically active. The second thing I want to mention is alcohol. Now, this may be a problem for some people, but may not be a problem for many. But I do want to bring this up because, especially in the Southern culture, alcohol is prevalent, especially during Alabama games. Now, the alcohol industry has done a great job at advertising the benefits of alcohol. And this one cardiovascular benefit of alcohol in moderation, that is the fact that people who drink a small to moderate amount of alcohol tend to have lower risk of heart attack. Somehow the alcohol lowers your bad cholesterol, and the end result is that people who drink wine tend to have lower risk of arteriosclerosis and heart attacks. But what they haven't told you is that next to this one benefit, there are multiple negative health effects of alcohol. Alcohol is a toxin for the heart. So although it reduces the risk of a heart attack, it weakens the heart muscle. That's the pumping chamber of the heart, gets weaker with alcohol consumption. Even a small amount of alcohol has been shown to transiently weaken the heart muscle. If you drink alcohol chronically, regularly, there's a risk that your heart muscle will get weaker and weaker, and you will eventually develop heart failure with all the consequences. That's a very serious condition. Alcohol increases blood pressure. One of the number one recommendations if you drink alcohol and you have high blood pressure is to stop drinking alcohol, and that will in itself bring your blood pressure down. Alcohol is one of the major causes for atrial fibrillation. That's a very common irregular heart rhythm that is becoming very prevalent, and many of you listening to this either have atrial fibrillation or have had it. So it's very important if you have irregular heart rhythms, especially atrial fibrillation, and you drink, you should drastically cut back, or even better, stop completely. Alcohol has a lot of calories, so if you drink alcohol regularly, you'll gain weight. So will contribute to you being overweight and obesity with all the consequences that we discussed. And last but not least, alcohol increases the risk of multiple cancers. This is not something that is very well known, but it has been clearly shown that excessive consumption of alcohol increases the risk of cancer of the mouth and throat, cancer of the larynx, that's the voice box, increases the risk of cancer of the swallowing tube, the esophagus, cancer of the colon and rectum, cancer of the breast, and of course, cancer of the liver. Alcoholics die from heart failure, cirrhosis of the liver, cancer of the liver. So if you have a heart condition, if you have high blood pressure, if you have atrial fibrillation and you drink, my strong suggestion is stop. Now, if you want to cut back, better than nothing. But overall, alcohol is a toxic for the heart. And ideally, if you have a heart condition, you need to stop drinking alcohol. Finally, one more word about diet and obesity. Our culture, especially in the South, is atrocious when it comes to eating habits. You know, I mentioned the high number of overweight and obese individuals in the Southeast. Alabama is number 3 or number 4 in terms of obesity in the United States. We eat a lot of things that are not healthy, and we add a lot of salt to our diet. Salt is probably one of the major culprits for high blood pressure, and in the South, we all just add it, even without tasting the food before. So my strong recommendation is, if you have any of these conditions, and most of these conditions are tied together. If you're diabetic, you have high blood pressure, your cholesterol is high, you might have had a heart attack, you have sleep apnea. So all these factors are together very important, and when you modify one, you tend to modify many. So cut back the amount of salt, cut back the amount of calories. Now, many patients ask for dietary recommendations, and you can talk to the dietitian. We have dietitians at Cullman Regional that you can contact. But I can give you my recommendation for diet in 2 words: eat plants. Eat plants. There is a fellow by the name of Michael Pollan who has written a ton of books about good dietary habits, and he summarizes his book in 3 lines. Eat food. Now, by food, we talk about natural products. Donuts taste great, but they're not really food. When we talk about food, we talk about what nature gives you. Eat food, mostly plants, not too much. And, if you want a lot of details, stop by our office at the cardiology clinic. We have some written dietary guidelines, but in general, the so-called Mediterranean diet, that is basically the same diet of the American Heart Association, is based on fruits, grains, vegetables, a little fish and chicken, and avoiding processed meats and white bread and high sugar contents. And with that, I'm going to finish. I hope you all have a great week and a great life, and do what is right for your health. Thank you.